Hello, everyone. My name is Dr. Lola with NSD Mental Health Services. Today, on the episode of Mental Health Talk, I will be covering anxiety disorders. What is anxiety disorders? Well, occasional anxiety is an expected part of life. You might feel anxious when faced with a problem at work, before taking a test, or before making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, school, work, and relationships. There are several types of anxiety disorders, and these include generalized anxiety disorder, panic disorder, and other phobia related disorders. Generalized anxiety disorders. People with generalized anxiety disorder display excessive anxiety or worry, most days for at least 6 months, about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety can cause significant problems in areas of their life like social interaction, school, and work. Generalized anxiety disorder symptoms include feeling restless, wound up or on the edge, being easily fatigued, having difficulty concentrating, mind going blank, being irritated, having muscle tension, difficulty controlling feelings of worry. Sometimes it interferes with their sleep. Difficulty of falling or staying asleep is mostly reported. Restlessness or sleep that is unsatisfactory. Panic disorder also. People with panic disorder have recurrent, unexpected panic attacks. Panic attacks are usually sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by a trigger, such as the feared object or situation. During a panic attack, patients may experience heart palpitations, a pounding heartbeat, or an accelerated heart rate, sweating, trembling, or shaking, sensation of shortness of breath, smothering or choking, feelings of impending doom, or feelings of being out of control. People with panic disorder often worry about when the next attack will happen and actively try to prevent future attacks by avoiding places, situations, or behavior that is associated with the panic attack. Worry about panic attack and the effort spent trying to avoid attacks cause significant problems in various areas of the person's life, including the development of what we call agoraphobia. All right, so let's talk about social anxiety disorder because that's also very common. People with social anxiety disorder have a general intense fear of or anxiety towards social or performance situation. They worry that actions or behavior associated with their anxiety will negatively be evaluated by others, leading them to feel embarrassed. The worry often causes people with social anxiety to avoid social interactions or situations. Social anxiety disorder can manifest in range of situations, such as within workplace, school, or even the environment. Agoraphobia are people with intense fear of two or more of the following situation. Intense fear of using public transportation, being in an open space, being in enclosed spaces, standing in line, or being in a crowd, being outside of the home alone. So, again, intense fear of two or more of the following. People with agoraphobia often avoid this situation in part because they think being able to leave might be difficult or impossible in the event that they have panic-like reactions or other embarrassing situation. In the most severe form of agoraphobia, an individual can become housebound. Okay, so what are some risk factors that causes anxiety disorder? Researchers are finding that both genetic and environmental factors contribute to the risk of developing an anxiety disorder. although the risk factors for each type of anxiety disorder can vary. Some general risk factors for all types of the anxiety disorders include temperamental trait of shyness or behavioral inhibition in childhood, exposure to stressful and negative life or environmental event in early childhood or adulthood. Again, people that have generalized anxiety disorder also sometimes struggle with post-traumatic stress disorder and things like that as well. A issue of anxiety or other mental illness in biological relatives. So it's important to ask about, you know, any issue of mental illness in the family. Does anyone in the family struggle with any mental illness? Sometimes it's also helpful to state what medications has worked for what family members, because sometimes that same medication might be able to work for the individual presenting for assessment. Some physical health conditions such as thyroid problems or heart arrhythmias or caffeine or other substance medication can produce or aggravate anxiety symptoms. So, for instance, if you know you struggle with an anxiety disorder, on the day you have an interview or the day you have an exam, when you take caffeinated beverages, coffee, you know, it might worsen the anxiety on those days. A physical health examination is helpful in the evaluation of a possible anxiety disorder. Sometimes thyroid problems can also lead to symptoms of anxiety, so it's important to ask for a baseline blood work, which sometimes includes like the complete CBC, CMP, AST, ALT, and things like that, to T3, 3, 4 thyroid stimulating hormones to help rule out other causes for the anxiety disorder or other mental illness as well. Anxiety disorder are generally treated with psychotherapy, medication, or both. Both psychotherapy and medication have been known to give the full effectiveness. There are many ways to treat anxiety, and people should work with their doctor to choose the treatment that is best for them. Some people like to start first with psychotherapy. Psychotherapy can help people with anxiety disorder. To be effective, though, psychotherapy must be directed at a person's specific anxiety and tailored to his or her needs. So it is individually based. What are some types of psychotherapy? Cognitive behavioral therapy is an example of one type of psychotherapy that can help people with anxiety disorder. It teaches people different ways of thinking, behaving, and reacting to anxiety producing and fearful objects and situations. Cognitive behavioral therapy can also help people learn and practice social skills, which is vital for treating social anxiety disorder. Cognitive therapy and exposure therapy are two cognitive behavioral therapy methods that are often used together or by themselves. To treat social anxiety disorder, cognitive therapy focuses on identifying, challenging, and then neutralizing unhelpful or distorted thoughts underlying the anxiety disorder. So they want to target the underlying causes of it. So it helps to explore the underlying factors. So it's important to consider therapy. Exposure therapy focuses on confronting the fears underlying an anxiety disorder to help people engage in activities they have been avoiding. Exposure therapy is sometimes used alone with relaxation exercises and other or imagery exercises as well. Cognitive behavioral therapy can be conducted individually or with a group of people who have similar difficulties. Often, homework is assigned for participants to complete between sessions. So it's important in this instance to take the homework assignment seriously, work on it so that you can be the better version of yourself. Medication can also help with anxiety. Medication does not cure anxiety disorders, but it can help relieve symptoms. Medication for anxiety is prescribed by doctors such as a psychiatrist and sometimes primary care provider as well. The most common classification of medication used to combat anxiety disorder are the anti-anxiety drugs such as the benzos, antidepressants, and beta blockers. The first line of management for anxiety disorders is, however, the antidepressants, or what we mostly call the SSRIs. But in the coming episodes, we'll be talking about the different classification of psychiatric medications as well. Anti-anxiety medication can help reduce symptoms of anxiety, panic attack, or extreme fear and worry. The most common anti-anxiety medication are called benzodiazepine. Benzodiazepine are sometimes used as first-line treatment for generalized anxiety disorder. They have both benefits and drawbacks though. Some benefits of benzos are that they are effective in relieving anxiety. They take effect more quickly than antidepressant medication, often prescribed for anxiety. So again, antidepressants are the first line management of anxiety. However, because of the fact that sometimes it takes a week or 2 weeks to start to see some improvement, 6 to 8 weeks to see the most effectiveness. Some people like the benzodiazepine, or some patients will request the benzodiazepine because of the immediate effect. But again, like I said, some drawback of benzodiazepine are that people can build up a tolerance to them. If they are taken over a long period of time, they may need higher and higher doses to get the same effect. Some people may even become dependent on them, so which becomes a problem in the long run. To avoid these problems, doctors usually prescribe benzodiazepine for a short period of time, a practice that is especially helpful for older adults, people who have substance abuse problems, and people who have become dependent or who have tendency to become dependent on medication easily. If people suddenly stop taking benzodiazepine, they may have withdrawal symptoms or their anxiety may return, which is called rebound anxiety. Therefore, benzodiazepine should be tapered off slowly. So again, good practice is to start off with the SSRI psychotherapy if you can. For long-term use, benzodiazepine are often considered a second-line treatment for anxiety, with antidepressant being considered the first-line treatment. Again, things like Zoloft, Paxil, Lexapro, Celexa are usually the first-line treatment in the management of anxiety. A different type of anti-anxiety medication is called buspirone. Buspirone is a non-benzodiazepine medication that is specifically indicated for the treatment of chronic anxiety. Though it doesn't help everyone, but at least it's a good try because it doesn't have as much negative side effects as the or the tolerance and the dependence side effects as the benzodiazepine. Antidepressants are used to treat depression, but they are also used in treating anxiety disorder. They may help improve the way your brain uses certain chemicals that control mood or stress. You may need to try several different antidepressant medication before finding the one that improves your symptom and has manageable side effect. A medication that has helped you or a close family member in the past may also be considered. Again, whatever medication has helped for your family member can help you as well. So it's important to know, oh, your mom takes this medication, it's been helpful, or your sister takes this medication and it has been helpful. Antidepressant can take time to work, so it's important to give the medication a chance before reaching a conclusion about its effectiveness. It takes 6 to 8 weeks to see the maximum effectiveness. Some people start to see some effectiveness within a week or two when you start taking this medication. If you begin taking antidepressant, do not stop them without the help of a doctor. When you and your doctor have decided it's time to stop the medication, it will be tapered off slowly, or stopping them abruptly can have withdrawal symptoms. So it's important to talk to your doctor and not just come in the next visit and say, oh yeah, by the way, I stopped taking my medication a week or two ago. Sometimes beta blockers are considered as well for managing anxiety, things like propranolol, blood pressure medications and things like that. These medications, when taken for a short period of time, can also help keep physical symptoms under control. They are used as needed basis because they are not FDA approved for anxiety. So again, you need to discuss with your doctor. It's based on individual, your assessment before making the right decision as to what medication will work best for you. It also depends on the other medications you currently taking as well. Support group is also a very good idea. Some people with anxiety disorder might benefit from joining a self-help or support group and sharing their problems and achievements with others. There are internet chat rooms that might be helpful, but any advice received over the internet should be used with caution, as internet acquaintances have usually never seen each other, and what has helped one person is not necessarily what is best for another. So it's very good to talk to your therapist, talk to your provider as to what medication or what treatment is best for you. Stress management techniques is also very helpful. Meditation is good, exercise is a good one, music, visual imagery is also good in managing anxiety. Some people like to go bed watching, tree watching, just enjoying nature, listening to your favorite podcast, just finding distraction, things that help to relax you is a very good way to manage anxiety. Well, I hope this episode has been helpful. If it has, please do not forget to subscribe to our channel, and I'll be coming up with more episodes talking about mental health. Thank you again. My name is Dr. Lola with NSD Mental Health Services, and enjoy the rest of your week. Thank you. Have a blessed day. Bye.